Hello everyone, myself Dr. Sayyid Abrar. Assist. Today we will see the cerebrum. Cerebrum is the largest part of the brain. This one is the cerebrum. It is highly developed in human. It is derived from telencephalon. It occupies anterior, middle and supratentorial part. This is the, here there is attachment of tentorium cerebelli. About that area is the supratentorial part of the posterior cranial fossa are occupied by the cerebrum. It is made up of outer grey matter and the inner white matter and some neuronal masses called basal ganglia within the white matter. Then the features. Cerebrum is made up of two cerebral hemispheres. These are the two cerebral hemispheres which are incompletely separated from the each other by the median or greater longitudinal fissure. This one is the median longitudinal fissure. These two cerebral hemispheres are connected to each other across the median plane by the corpus callosum. This is the cut section. This one is the corpus callosum. Each cerebral hemisphere contains a cavity called lateral ventricle. The surface area of cerebrum is 2000 square centimeter. Then the external features of each cerebral hemisphere. The cerebral hemisphere has three surfaces, four borders, three poles and four lobes. Surfaces. This one is the lateral surface or superolateral surface. This one is the medial surface. Below is the inferior surface. This one is the inferior surface. These are the line diagrams. Then the lateral surface or superolateral surface is the convex and is related to the cranial vault or vault of the skull. Medial surface. This medial surface is flat and vertical as and related to the falx cerebri and the median longitudinal fissure. This inferior surface is divided by the stem of lateral sulcus into anterior orbital part and the posterior tentorial part. Then the borders. There are four borders. Superomedial border. First is the superomedial border. This in the upper part there is a superomedial border which separates this lateral surface from the medial surface. This is the coronal section. Diagram taken from the Vishram Singh Clinical Neuroanatomy, that is the nice book. This is the inferolateral border which separates lateral surface from inferior surface. Its anterior part, this part is known as superciliary border. Then the medial orbital surface. This is the medial orbital surface which separates vertical medial surface and the orbital surface. This one is the medial occipital border which separates medial surface from tentorial surface. Then the poles. Each cerebral hemisphere has three poles. This one is the frontal pole at the anterior end, this one is the occipital pole at the posterior end, and this one is the temporal pole. And each cerebral hemisphere has four lobes. This one is the frontal lobe, this is the parietal lobe, this one is the occipital lobe, and this one is the temporal lobe. Then there are different fissures and elevations on the cerebral hemisphere. This human brain is the gyrencephalic. The fissure is known as sulci and the elevated part is known as gyri. Then the first we see the sulci on the superolateral surface. There are different sulci on the superolateral surface. I will show you the diagram. This is the line diagram. First is the lateral sulcus which separates, this one is the lateral sulcus which separates frontal and the parietal lobes from the temporal lobe. And the central sulcus, this one is the central sulcus which is just behind the midway between frontal and the occipital pole. It descends downward and forward, making an angle of 70 degree with the vertical plane. It ends slightly above the lateral sulcus. Finger breadth anterior and parallel to the central sulcus is the precentral sulcus, and one breadth or finger breadth posterior to the central sulcus and parallel to the central sulcus is the postcentral sulcus. This one is the postcentral sulcus. There are superior and inferior frontal sulcus on the frontal lobe. This one is the superior frontal sulcus. This one is the inferior frontal sulcus. These superior and inferior frontal sulcus divide the frontal lobe into three gyri. These are the superior temporal sulcus. This one is the inferior temporal sulcus, which divides the temporal lobe into three gyri. This is the interparietal sulcus, which divides the parietal lobe into superior and inferior parietal lobule. This is the lunate sulcus on the occipital pole, that is the inverted half moon shape sulcus. Then this is the diagram from Vishram Singh. This is the central sulcus. Anterior to central sulcus is the precentral sulcus. Posterior to central sulcus is the postcentral sulcus. On the frontal lobe, this one is the superior frontal sulcus. This one is the inferior frontal sulcus. This is the lateral sulcus. This one is the superior temporal sulcus. This one is the inferior temporal sulcus. This is the lunate sulcus on the occipital lobe. This is the interparietal sulcus on the parietal lobe. Then the gyri. Gyri on the superolateral surface. There are different gyri. First is a precentral gyrus area between central sulcus and pericentral sulcus is known as precentral gyrus. This area is known as precentral gyrus. Postcentral gyrus area between central sulcus and postcentral sulcus is known as postcentral gyrus. This area is known as postcentral gyrus. Then the superior, middle and inferior frontal gyrus. These two sulci, superior frontal sulcus and inferior frontal sulcus, divide the frontal lobe into superior, middle and inferior frontal gyrus. These are the superior, middle and inferior frontal gyrus. Then the superior and inferior temporal gyrus. This superior front temporal and inferior temporal sulcus divide the temporal lobe into superior, middle and inferior temporal gyrus. These gyri are superior, middle and inferior temporal gyrus. Then the angular gyrus. This one is the angular gyrus on the parietal lobe, that is the area around the posterior end of the superior temporal sulcus. This is the superior temporal sulcus, its posterior part. This area is known as angular gyrus. This is again line diagram showing different gyri. This is the precentral gyrus. This one is the postcentral gyrus between central and postcentral sulcus. Area above the superior frontal sulcus is the superior frontal gyrus. Area between superior and inferior frontal sulcus is the medial frontal gyrus. Area below the inferior frontal sulcus is the inferior frontal gyrus. Area between lateral sulcus and the superior temporal sulcus is the superior temporal gyrus. Area between superior and inferior temporal sulcus is the middle temporal gyrus. Area below the inferior temporal sulcus is the inferior temporal gyrus. This one is the angular gyrus around the posterior end of the superior temporal sulcus. This one is the interparietal sulcus, which divides the parietal lobe into, this one is the superior parietal lobule. This area above the interparietal sulcus is the superior parietal lobule, and area below the interparietal sulcus is the inferior parietal lobule. And sulci on the medial surface. This is the corpus callosum. This one is the splenium, this is the body or trunk of the corpus callosum, this anterior part is the genu of corpus callosum, this one is the fornix. Just parallel and just above the corpus callosum is the callosal sulcus. 1 inch above the callosal sulcus and parallel to the callosal sulcus is the cingulate sulcus. This one is the cingulate sulcus. The parieto-occipital sulcus. This one is the parieto-occipital sulcus, which starts from middle of the calcarine sulcus, goes upward and crosses the superomedial border. This calcarine sulcus starts just below the splenium, below and behind the splenium, arc backward and upward, goes towards the occipital pole. Posterior end or extension of the calcarine sulcus is known as post-calcarine sulcus. This sulcus is known as post-calcarine sulcus. These are the 4 sulci, 5 sulci on the medial surface, then the gyri on the medial surface. This one is the cingulate gyrus between callosal sulcus and the cingulate sulcus. Just above the corpus callosum, this gyrus is known as cingulate gyrus. Paracentral lobule, this area is known as paracentral lobule, which is bounded above by the superomedial border, below by the cingulate sulcus and behind by the extension of the cingulate sulcus. This is known as paracentral lobule. Area behind the paracentral lobule is known as precuneus. This area is known as precuneus. And the cuneus, last gyrus on the occipital lobe, this triangular area is known as cuneus, which is bounded anteriorly by the parieto-occipital sulcus and below by the extension of the calcarine sulcus, that is the post-calcarine sulcus. Then the sulci on the inferior surface, this one is the olfactory sulcus, just medial to the medial orbital border is the olfactory sulcus. Just lateral to the olfactory sulcus, there is irregular H-shaped sulcus, that is known as orbital sulcus. This one is the stem of lateral sulcus, which divides the inferior surface into anterior orbital part and the posterior tentorial part. Rhinal sulcus, this anterior part, in the anterior part of the temporal lobe, there is small vertical sulcus known as rhinal sulcus. Collateral sulcus, behind the rhinal sulcus, there is a collateral sulcus which extends up to the occipital pole. Lateral to the rhinal and collateral sulcus, there is a occipitotemporal sulcus. This sulcus is the occipitotemporal sulcus. This is again the diagram from Vishram Singh. This is the rhinal sulcus, this is collateral sulcus, is the occipitotemporal sulcus. And the gyri on the inferior surface, there are different gyri on the inferior surface. First is the gyrus rectus, which is medial to the olfactory sulcus. This one is the gyrus rectus, area between medial orbital border and the olfactory sulcus. This gyrus is known as gyrus rectus. There are anterior, posterior, medial and lateral orbital gyrus around the irregular H-shaped orbital sulcus are the anterior, posterior, medial and lateral orbital gyri. Then the lateral occipitotemporal gyrus, this area lateral to the occipitotemporal sulcus is the lateral occipitotemporal gyrus. Area medial to the occipitotemporal sulcus is the medial occipitotemporal gyrus. Then the parahippocampal gyrus. Area medial to the rhinal and collateral sulcus is known as parahippocampal gyrus. This area is known as parahippocampal gyrus. Area below the parahippocampal gyrus is known as lingual gyrus. This area is known as lingual gyrus. This anterior hook like part of parahippocampal gyrus is known as uncus. These are the gyri on the inferior surface. Thank you. I will show you